Welcome to the OVA vlog. This is part 3 and our last episode focused on women's reproductive cancers. And we today are, this episode is specifically about ovarian cancer. And we are joined by Dr. Song, who studies reproductive cancers, and Erica, who works at a lab studying ovarian cancer. So we're really excited to hear about your work. But to get started, what is ovarian cancer?
So ovarian cancer starts in the ovaries. Every woman are born with 2 ovaries, usually, next to the uterus, which contains the eggs for reproduction.
And what are some of the symptoms a woman might feel when she has ovarian cancer?
So with ovarian cancer, it's very non-specific. So I know with uterine cancer or cervical cancer, people come in with vaginal bleeding. But for ovarian cancer, people come in with either abdominal swelling, like bloating. Maybe they have, they get fuller quickly, or some weight gain around their abdomen. So it's very non-specific for ovarian cancer. Okay. And usually that's a sign of advanced disease, unfortunately.
Okay. And how many women are diagnosed with ovarian cancer in the U.S. every year?
So about 22,000 women are diagnosed with ovarian cancer per year. So a lifetime risk is about like 1 in 75 women are diagnosed with ovarian cancer every year. Yeah,
wow.
that's a lot.
And is that, in earlier episodes we talked about, typically this happens postmenopausal.
Yeah.
That's also true
Exactly.
for
Yep.
ovarian cancer.
Mm-hmm.
Okay. And what are some of the screening that a woman can go through? I mean, you kind of just hinted that there really is no screening.
Yeah. So unfortunately, unlike cervical cancer with the pap smear, there really is no screening for ovarian cancer. So like Mihai said, typically women come in with more advanced symptoms, and when the ovarian cancer is found, a lot of times it's more advanced stage as well. So, you know, one thing that we're trying to do here at the U of M is trying to develop new screenings for ovarian cancer, but currently there just isn't one, so you have to be, you know, really in tune and make sure you're going in to get your checkups and talking to your doctors if you're having any symptoms.
So I'm really happy to hear that they're working on screening for ovarian cancer. Way to go,
Yeah.
University of Minnesota. What are some of the advancements that are taking place when it comes to ovarian cancer?
Mm-hmm. Yeah, definitely. So typically, again, depending on the stage, ovarian cancer patients will have surgery followed by chemotherapy. I don't know if they have a lot of radiation.
No, not too much.
Yeah, not too much radiation in ovarian cancer, but some a recently approved drug that seems to be pretty exciting. FDA approved drug called PARP inhibitors has been approved, and that seems to help some women battle recurrent disease, so disease that has been treated but then comes back, which is usually a very poor prognosis with those recurring diseases. And then with the PARP inhibitors, that new drug, that typically works best in women that have the BRCA mutations or the BRCA mutations you may have heard of. So, yep, that's one new.
What are those? Are those mutations specific to ovarian cancer?
Breast cancer and
Okay,
ovarian
yeah.
cancer.
Okay.
Yep. So yeah, for example, Angelina Jolie, she had the mutation in that, and she decided to remove her ovaries, for example.
And
mastectomy as well.
Yeah.
So.
And what is the prognosis for ovarian cancer?
So it's usually pretty poor because people come in with advanced stage of ovarian cancer, but so people look at it as like a chronic disease. Usually, you know, people will respond pretty well to chemotherapy initially, but then usually the cancers usually come back. Because most women who come in newly diagnosed, they come in late stage, like 3 or 4. So unfortunately, it's a disease that will come back.
Okay. So we gotta work on some treatments and some screenings. Screenings, yeah. Mm-hmm. Well, thank you guys so much for joining us. This has been really it's just really important to know like what these cancers are. We hear about cancer, and there are very specific ones that we can just kind of be paying attention to our bodies, especially after menopause. So, thank you guys. Thank you.